This is also a unique patient. She came in, she's seen a lot of different providers, she's tried PT for 6 months. Technically speaking, we don't see anything anatomically wrong. So she was a gymnast previously, so sometimes gymnasts can have some degenerative changes earlier than we expect in life. They can even just have some congenital malformations from doing that high impact activity. But most of the time, what we see is their biomechanics, their movement patterns just aren't fully what we want them to be. So she brought in an MRI, she brought in x-rays, everything technically reported normal. It's one of the cleanest MRIs I've actually ever seen. The report said everything was great, but she still has low back pain. She's had low back pain for, I think it was 9 years. This is something we want to intervene on. We don't want our patients in pain, and we definitely don't want to tell them it's all in their head. Just because we don't see anything on an MRI or an x-ray doesn't mean that something's not going wrong. It doesn't mean there's not inflammatory markers circulating. It doesn't mean that muscle spasms aren't occurring. If there is any joint space irritation right here, then this is going to bring it down. This is a low circulation area, so getting it down naturally is pretty difficult. And you've never heard anything like spina bifida occulta mentioned or anything like that?
No, what is that?
If that is not a finding, that's great. And we know that it's not producing pain for you. But to have all this sacral irritation for that long, we got to be pretty aggressive about this laser. Since there's nothing wrong on the MRI that we saw, we can either assume it's a false negative, or we can assume that something's wrong with the way she's moving. How I like to go about it is introducing mobility to the joint. As a chiropractor, that's always pretty much step one for me, is to get the joint moving as it should. And then I want to decrease the inflammation at that joint space. So what you're seeing with the laser is something I like, especially in low circulation areas. So we're hitting that SI joint to see if we can bring down the inflammation. And if that inflammation goes down and the pain goes away, then we know we're in the right location, we're doing the right thing. Now, if the pain goes down, we take a break and the pain comes back, then we know we're getting rid of the inflammation and that there's a movement pattern that's bringing that pain back. So I like this as a trial of care to see if we can get everything under control. And then if it comes back, we know we've got to address some underlying movement issues. Figuring out the movement issues is where I think the highest skill cap comes in. And I have to thank people like Brad Muse and other providers that have really taught me a lot about what movement's correct, what posture is correct, what's good for you, what muscles are moving right, what muscles are moving wrong. There's so much that can go into it. As a provider, I hate to see my patients in any sort of pain or dysfunction, but I love the challenge of finding what we need to do to provide that alleviation long term. Before she came into this office, she was actually being referred to a pain specialist. Do you want to hop on pain medication for life for something you're not sure what's going on? That's your call. I think there are other routes available. I like to have people come in. I want to try my hand at making you feel better, getting you moving better, making your life a little bit less stressful and a lot less painful. If you're ever interested in anything like spinal decompression, adjustments, manual therapy, laser, physical therapy, we do it all here because we like to have tools to make people better and get them back to their lives.